Good morning, ladies and gentlemen. Good morning to everyone. I'm MPP Mike Cole, MPP for Eglinton and Lawrence. I'm here today with a number of very prominent doctors and community activists from everywhere from Ottawa to Toronto. And we're here on basically what is Sickle Cell Awareness and Thalassemia Day in Ontario and at Queen's Park. So today, as part of bringing awareness about these silent diseases that affect so many Canadians, we are here to try and tell the story of so many people who can't tell the story of the suffering, the silent suffering that those that are afflicted with sickle cell disease, or thalassemia, the agony and the pain that they go through. So this is about their story that we're telling for them. And I'd just like to introduce a number of people who are here. On the front podium with me are on my far left is Dr. Isaac Adame. And Dr. Adame has been a long-time advocate of better treatment and better research for sickle cell and diseases of the blood. He's a professor at the University of Toronto of pediatric medicine. He's been involved with the United Nations efforts to bring awareness to sickle cell disease. He's part of the Global Sickle Cell Disease Network. So Dr. Adame will be speaking a little later. We also have with us on my right is Helen Ziavadas. And Helen is the president of Thalassemia Foundation of Canada. She's a mother, she's a volunteer, she's a non-stop advocate for the thousands of families that go through incredible hardship with thalassemia. She does this on her own time. She raises money, raises awareness, and Helen is typical of a lot of parents and mothers who are trying to bring help for their children, help for their friends who are afflicted with thalassemia. Welcome, Helen, and she'll speak a little later. On my immediate left is Lanre Tunji Ajayi, who's the president and founder of the Sickle Cell Awareness Group of Ontario and president of the Sickle Cell Disease Association of Canada. Lanre is another volunteer, tireless worker, advocate, persistent you might say spokesperson for people with sickle cell. She has been taking the cause of sickle cell awareness to Ottawa, across Canada, and again, she does it as a volunteer because she knows full well the devastation of this disease, especially when there isn't the proper treatment for people with sickle cell. Welcome, Lanre, and Lanre will speak in a few minutes. And also with us today, we should mention that we have some very renowned doctors who are in the front lines of sickle cell disease, who do incredibly effective work. And I'd just like to mention, I hope I've got them all, about Dr. Klassen, who came all the way from CHEO Hospital in Ottawa to be with us today. Dr. Klassen, thank you so much for being here and the incredible work that you do at CHEO, one of Canada's renowned children's hospital in Ottawa. Also, we've got from Toronto General Hospital, we've got Dr. Ward that's here. Dr. Ward, thank you. Just down the street, I think I've met you at a couple of the events over the years. And with your colleague, Dr. Jacob Prendergast, just down the street, again, at Toronto General Hospital, who has an amazing treatment critical mass facility at Toronto General. I know the incredible work you do with adults with sickle cell disease at Toronto General Hospital, Dr. Jacob Prendergast. So I want to thank you doctors for the incredible leadership and the fact that you're here today with your incredible busy schedule. I think it demonstrates your commitment to helping people. And you see the real pain that they go through. So thank you, doctors, for being here in your challenge. We've also have a couple of people who are also on the front lines from being public advocates and being just, again, concerned advocates. We've got Sherman Moore, who tells an amazing story about his family and what they go through. Sherman, it's great to see you here today. You know, you represent a lot of people out there can't speak for themselves. Thanks, Sherman, for the work that you do. Also, we've got an amazing nurse that is here with us today that has been given many awards, and she's out of Sick Kids Hospital. It's Karen Fleming. Yeah, Karen Fleming. Yeah, Karen, good to see you here as frontline nurse who dedicates her life to fighting sickle cell. Thank you, Karen, for being here. And also, we've got another longtime advocate of bringing awareness to the government and to the public at large about sickle cell. She's a wonderful spokesperson and advocate for sickle cell awareness and many other critical issues, and she's the president of Ontario Black History Society, Rosemary Sadler. Thank you for being here, Rosemary, too. So I think the breadth of the people that are here today demonstrates how critically important it is for us to pay more attention to sickle cell disease and thalassemia. As a government, as elected officials, and I should mention Frank Cleese is here, my colleague and good friend, member for Newmarket Aurora. Thank you, Frank, and I know you're of great help and concern, and it's wonderful to see you here because these people need our support, as you know, as MPPs, to bring this forward so government can do more to help people that are in all of our ridings are affected by these horrible diseases. So thank you, Frank, for taking time to show your support today. Next is Lanre Tunji Ajayi is the president of the founder of Sickle Cell Awareness Group of Ontario and Sickle Cell Disease Association of Canada. Lanre.
Thank you. I just would like to start by saying that I'm the founder of Sickle Cell Awareness Group of Ontario, but not the president. Ms. Doreen Alexander, right there, is the president of the organization.
Okay, sorry.
Thank you. Good morning, Honorable Michael. Honorable Frank Cleese, who has been my MPP for many years and a strong supporter of the Sickle Cell Awareness Group of Ontario. Thank you for being here. Delegates from the sickle cell and thalassemia communities and the attending dignitaries. In 2006, as Dr. Odami said, Ontario has expanded the newborn screening program to include sickle cell and thalassemia disorders. While we are grateful that babies born with sickle cell disease can finally be identified and placed on life-saving treatments such as prophylaxis penicillin, the reality is babies born in her province, such as baby Jane, with sickle cell disease will continue to grow. Baby Jane will grow from babyhood to childhood to adolescence and to adulthood. The question is, how do we provide coordinated care for baby Jane and thousands living with sickle cell disease in our province? How do we reduce the unnecessary cost to the healthcare system that is accumulated by the constant emergency visits to the hospital and also to inpatient hospitalization? How do we improve care, treatment, and the quality of life for the many thousands living with both sickle cell and thalassemia disorders? From sickle cell and thalassemia community, we know that the solution is simple. We must emulate disorders such as diabetes, hemophilia, and cancer by simply organizing the available resources to bring about sickle cell and thalassemia care in Ontario. Just as with cancer care, a coordinated program will help the healthcare providers in providing the coordinated care. It will afford us a record of the individuals with this disorder. Most importantly, it will save unnecessary healthcare costs. In 2006, the World Health Organization passed a resolution calling for the development and implementation of national integrated program for the prevention and management of sickle cell anemia in particular. This multi-system disorder needs a comprehensive approach, and this is the reason for Action Day Ontario. I would like to take a minute and thank Dr. Mandeline, who came all the way from Hamilton, because we need to have an improved care for people living with sickle cell in Hamilton and other parts of Ontario. Thank you. Almost 20 years ago, I lost my brother, a smart engineer, to the complications of sickle cell disorder. In 2012, I attended 4 funerals in this province. Victims were all under 35 years old. Last year, we lost a 16-year-old. They are Ontarians, they are Canadians, and they represent lost skills to our workforce. So, on behalf of the Sickle Cell Disease Association of Canada, we, as delegates from the sickle cell and thalassemia community, we are calling on the Ministry of Health to review and approve the proposal that the Sickle Cell Awareness Group of Ontario presented on November 20th, 2013, and organize the available resources to accommodate sickle cell and thalassemia care Ontario. Honorable Michael's bill, if passed, will move and bring thousands of Ontarians with sickle cell and thalassemia disorders and the caregivers to a new day. Thank you. Thank you, Honorable Michael.